Cold therapy is a standard these days as a medical treatment for patients undergoing surgery. In my case, oral or orthodontic surgery to prevent pain and swelling. There are different possibilities of cryotherapy for patients after surgical interventions. On the one hand, there is the classic approach with ice bags or conventional cool packs, and on the other hand, there are the cooling pads from emcools. The practical advantage of the cooling pads from emcools is that one can achieve a very good cooling temperature between 10 and 15 degrees directly on the skin, combined with a sufficient deep impact. There is no need for protective layers that are required with other cool packs. They can be applied directly on the skin, and the deep effect and cool temperature will have a long and constant effect. The cooling pads themselves contain HypoCarbon, which is a patented liquid emulsion. The doctor should freeze the pads in advance, so they can be applied right away after surgery. It is important to freeze the pads before surgery in order to use them right away after surgery. Start by removing the protective foil from the pad and place the pad with the smooth side to the skin. The patient is usually provided with an additional cooling pad in order to continue the cooling at home. Once the initial pad has thawed, the patient should in effect cool down for 20 to 30 minutes after surgery. Take a break for 20 to 30 minutes and then apply the second pad. The biggest problem for patients after surgery, or the biggest anxiety, naturally always is pain and swelling. The patient always asks, how bad will the swelling be? How long will it last? Will I have intense pain? Since I have started using the cooling pads in my practice, my patients have reported very good pain relief with hardly any swelling after surgery. So the feedback has been extremely good and the product has been extremely well received. Patients coming in for follow-up appointments report less pain and swelling, what is always their biggest concern pre-surgery. The advantage for patients using the cooling pads is that they are very practical to use. It's not a bulky ice pack that needs to be held constantly. The cold pack stays nicely dry and it quickly achieves an optimal cooling effect that remains constant for 20 to 30 minutes. And there is less pain, because it offers fast cooling that can be continued easily at home.